Hello, everyone. I welcome you all to another episode of Meet the Knee Expert. Thank you, Dr. Parag, for being here and giving your valuable time. In today's episode, we're going to discuss about importance of exercises in knee problems and also in after knee surgeries. So, thank you so much, Dr. Parag, once again.
Thank you, Dr. Saurabh, for hosting this program one more time. It's really a pleasure to be on Meet the Knee Expert program.
And it's fantastic for us and our audience to have you and get our questions answered by you. So in today's episode, sir, we wanted to discuss. You always have mentioned the importance of exercises.
Yes.
You have also told us always that 98% of patients that you see in your OPD do not require surgeries. And to those patients, you majorly ask to continue with exercises and other things. And we wanted to pick your brain more on that topic.
Sure.
All right. So how would you define, like in your words, why exercises are important?
Yeah. So, as all of you know, I am a knee expert, and majority of the patients coming to my OPD are having knee problems. And majority of them, believe me, can be treated without surgery with a good exercise rehab physiotherapy program. And as you said, why? Why and how does this help? So I think exercises has multiple advantages. Number one, whenever we are exercising, it strengthens the muscles, the quadriceps, the hamstring, which are around the knee. It also improves the blood supply to the bone and thereby making the bones more stronger. And the third most important reason is it maintains the flexibility of the knee joint, and range of movement is very important. So these are the three main advantages of doing exercises and how it can help in various knee pathologies and also before and after surgeries.
All right. Thanks so much, sir. In the recent years, we all have seen that the number of knee surgeries, knee replacement surgeries has gone up quite a bit. One of the most common reasons that comes up for that is lifestyle of people has become sedentary. Would you consider that as one of the primary reasons why this is happening? And second, what kind of preventive exercises people can do so that they can avoid or prevent it as
Yeah.
much as possible?
So there are various reasons why the incidence of knee osteoarthritis has gone up. It was always there, but what we are seeing now is because of the previous old injuries, the number of patients having arthritis is more. As you rightly said, one of the reasons is sedentary lifestyle where they do not exercise the knee and the rate of degeneration can be faster. And the third and actually the most important reason is people are now paying more attention to their knee pain. It was always there, but they were not diagnosing it, doctors were not treating it, and therefore it was not being measured or it was not being recorded, and therefore we thought the incidence was less. So that is why we are seeing more and more arthritis patients, and definitely exercise is an important part of treatment of knee osteoarthritis or any other knee type of arthritis.
Right. So you meet so many patients on day-to-day basis. What are the most common myths or misconceptions that you have come across that people have in their mind about exercising?
Yeah, so that's a very good question. Many people do feel that the exercise is not really important because if the joint is arthritic, by doing exercises more or putting it to more exertion, the arthritis might increase. But that is a very, very big myth, and that is absolutely not true. The second, people feel that by exercise it will cause more fatigue to the muscles and thereby increase the pain. So people used to always ask me that do I really need to exercise, and sometimes the exercise increases the pain, but I always tell them that you have to exercise, and initially when they start the exercise or the rehab program the pain does increase, but later on it definitely reduces and it only helps the patient to reduce their pain and to help to control arthritis.
Whenever I interact with patients and I ask them, what is your exercise routine before understanding and assessing them? The most common thing that people say is, I walk 45 minutes, I walk 1 hour, I complete 10 kilometers of walk every morning. And people, even after they have developed osteoarthritis, they still continue to do this walking as an exercise apart from doing any strengthening. So, what are your thoughts on that? Is walking alone a good exercise? Has to be complemented with anything else?
Yeah, well, so let us understand what is osteoarthritis. Whenever I see a patient of arthritis, there is essentially a wear and tear he has in his knee joint. The cartilage of the femur bone and the upper end of the tibia is getting degenerated. So any kind of exercises which is actually going to increase the degeneration, is not a good idea at that particular time if it is proven on x-rays. So at that time, activities like jumping, skipping, aerobics, which is going to increase the impact on the knee, is not definitely a good exercise because the rate of degeneration will go up. So in these conditions, what is good? So as you just said, walking. So walking on a plain surface without any inclination or slope is again a good idea because that will help to definitely tone the muscles and improve the flexibility of the knee joint. So definitely once it is a proven case of arthritis, we have to talk to the orthopedic surgeon, we have to talk to the physiotherapist and then decide which exercises are going to actually suit you and which are not going to suit you. Broadly speaking, any exercises which increases the impact or increases the pressure on the knee is not going to be good, it's going to be harmful. But any exercise which improves the flexibility without causing pressure, any exercise which tones the muscle without really putting pressure to the cartilage are good exercises.
Once someone is recommended a knee replacement surgery, what are your thoughts on prehabilitation? Because there's not a lot of awareness amongst people about prehabilitation. So can you enlighten our audience about
Yes. So whenever I advise a patient a knee replacement, there are two kinds of patients I have. One who has already done exercises, who knows a little bit of physiotherapy, and those are the patients whom really post-op they do quite well because they know their part of the knee which they need to exercise well. The second type of patients are who haven't really done any physiotherapy program. For them, prehabilitation, which is the new concept that before surgery we do rehabilitation, that is pre-surgery rehabilitation is prehabilitation. So that is something, the prehab exercises are important because after doing a successful knee replacement surgery, the range of motion is again important because we have to cut the muscles become weak, and if you don't exercise them, then the muscles can become flabby, the muscles can become wasted and cause more pain. Therefore, prehab and keeping the exercises known to the patient, telling them that even though there is pain, you have to do it, is an important aspect so as to prepare the patient mentally after the exercise that it is important. So I would say prehab is very important, and once that is done, the patients know what to do after the surgery and it comes to them quite naturally. And anything a patient is expecting and patient is knowing that he or she has to do it after the surgery, then they are more prepared mentally and then it becomes a very, very smooth and efficient process.
All right, thank you, sir. When somebody has recommended a surgery and they have planned to undergo a surgery, if I have to ask you, okay, give me three do's and three don'ts while they wait to get their surgeries done.
So while they are waiting to get their surgeries done, my particular aim is to keep the flexibility and the motion of the knee. So they should do exercises where they are doing the range of motion exercises. They can at the most put some weight on the ankle and do exercises against resistance. So that is one particular thing. If they are doing their daily walks, they can still continue to walk, but it should not be for long distances and it should not cause pain. Second, the third part which I always tell them is avoid using steps going up and down, avoid squatting or kneeling or sitting down because that increases the pressure while getting up. Sitting is not a problem. So sitting down on a ground, people do meditation or puja, but while getting up, the pressure on the knee is so much that the rate of progression of the arthritis can actually increase. But if they want to sit on a couch or some bed and then they have to get down, not to get up from the bed, then that is okay. So these are the three precautions which I would advise my patients before surgery.
All right. Post surgery, many people have this thought in their head that I need to rest. If I rest, then the healing will be all right. And that's the reason why people are a little wary of starting with exercises right after. So how soon people should start exercises, and how soon do you recommend them to start exercise?
I think that is an excellent question, and I would say the day the surgery is done, that evening we should start exercising. We should not even wait for the next day. And the reason for that is nowadays the pain control is so much better. Initially, the pain was there, and the patients were skeptical that I already have so much pain, doctor. How can I start exercises? But now, with the advances in pain management, the post-op pain has reduced a lot, and patients can start exercises the same day, the same evening, and therefore improve their path to recovery. So I would say the exercise should be started immediately. On day one, they can be a little slow exercises, just quadriceps strengthening, hamstring quadriceps exercises, isometric exercises, foot and ankle pump, because if you do the foot and ankle exercises, that also is known to prevent deep vein thrombosis. That is, the clot which gets through the vein can go into the lungs or the brain or the heart. So doing those foot and ankle pumps, doing the isometric knee exercises definitely helps, and we start that on day one of the surgery.
Now, in the recovery process after the surgery, how many weeks of supervised physiotherapy is required? And post that, for how long do you recommend that a patient needs to, or a person needs to continue the exercises?
Yes. So once a knee replacement surgery is done, I would say that the patient is in the hospital for about 48 to 72 hours. Nowadays, we discharge the patients quite early. So that time, definitely it has to be a supervised physiotherapy program. Once they go home, up to the stitches are removed, or maximum up to 3 weeks, I would say that, patients do need some supervision. They need more, so they need little motivation.
Right.
They know what the exercise is to be done. But if a physiotherapist goes home and does those exercises, then they feel assured, and they feel that somebody is coming, so they are more answerable and responsible and accountable to do the exercises. So the stitches generally come out on the 15th day after doing a knee replacement. Up to 3 weeks is what a supervised physiotherapy program should be done, and then the patient is comfortable. The walker is removed. There is no aid. There is no stick. Patient is walking independently, and then that is the time the patient can also do his or her exercises without any supervision. So max about 4 weeks is what I would say the supervision is required after a knee replacement surgery.
All right. Fine. And then how long do they need to continue those exercises on their own?
I would say at least for a period of 3 to 6 months. And most of the times I tell my patients that make a routine to do the exercises daily.
Correct.
Why should you stop after 3 months or 6 months? You should continue it daily, do the exercises on a regular basis, and you develop a routine, a habit to do those exercises. But minimum, I would say, is like 6 months is something they should definitely do on a regular basis, and after that they can see how the knee is shaping up.
Right. You just spoke about keeping the motivation high of a patient, and that's why supervision becomes the key. What tips would you give our audience to stay motivated? Because when there is pain, exercises can become very difficult or challenging. They can't see a bigger picture. So what tips would you give our audience so that they can stay motivated through that
See, one thing
difficult
is
journey?
sure, that if you do exercises, if you keep the muscles toned, the recovery is going to be much faster. Your return to work is going to be much faster. So patients always ask me, when can I go back and join work? Because nowadays I'm operating on patients who have to get back to work because they have a job. And I have seen that even though sometimes there is pain, but yet if they do the exercises regularly, their return to work, their return to their jobs is much faster. So the motivation number one is their recovery is going to be faster. They will be able to go back to work faster. Number two, I think more important is to ensure that the muscles which are cut during surgery, they heal faster. And by doing exercises, the healing is definitely better. So that is an important thing which if we tell the patient that your muscle strength will come back really to the normal if you exercise regularly, otherwise it won't, then that's another motivation, an important factor to make sure that the patients do exercise regularly.
Thank you so much, sir. You've really enlightened our audience on importance of exercises and different scenarios where exercises really matter, pre-surgery, post-surgery, and how to make sure that through our like how exercises should become a lifestyle. I think that's what we take as a keynote from your conversation, from our conversation today. Thank you so much once again, sir.
Absolutely. So just to conclude, Dr. Saurabh, I think exercises are very, very important, very critical. And my message today is, even if you don't have arthritis, even if you don't have knee pain or joint pain, do exercises as a routine. Generally, what I've seen after the age of 45, 50, 55, that is the time when the joints are going to get arthritic, osteoporosis is going to set in. In the female patients, there are going to be hormonal changes. So this is the time, the vulnerable period, 45 to 55. So even if you don't have joint pain or knee pain, make exercise a regular schedule of your life. Make it as a habit. And if you do that, it definitely will not only help to prevent joint pain, knee pain, but also is important for well-being. It gives you a good sense. It gives you joy, happiness, and because of exercises, I have seen that the concentration or the efficiency in work also improves. So there are a lot of advantages of exercise. It will suffice to say that you have pain or no pain, please do your exercises on a regular basis. What kind of exercises to do, what not. There are physiotherapists, there are orthopedic surgeons who will guide you, but definitely keep exercising, keep moving, and then you will avoid joint pain and knee pain. Thank you.